Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking time out to spend with us today. And we hope that we give you some, let me change that. I know we're going to give you some information that will improve your quality of life. And yes, I know I look like a relic from the old West, like a cowboy. Well, maybe not because it's not checkered. But, you know, in being safe, this is called Your Faith and Health Community. And I just want to say for some people who figure like, well, why are you wearing a mask? Actually, I had somebody say to me, you're a man of God. Why are you wearing a mask? Where's your faith? Well, I posted on Facebook the other day that Noah did not get off the ark to prove his faith. He stayed on the ark that God had given him for safety for him and his family. And to just summarize my post, and you know the story, he and his family survived. So I'm wearing a mask because that just makes good sense. Doesn't mean my faith isn't strong. In fact, my faith is in God, that God will allow this mask to protect anything that would come at me. So when you're out in public, if you decide, and at the end of the day, it's obviously your choice, but just for my safety, I have some of the underlying conditions. I'm a heart patient, all those things. So I'm just going to be smart. And I'd rather this be a waste of time and be safe than realize that it was necessary and then I'm laying up in the hospital with a ventilator. Not that I'm saying you will, and we know that God is able. Also, the last thing I'll say, and I know you're like, wait a minute, he's not talking about health care. And I'm not, because we're going to be talking this whole show about health care. So no need of me giving you the spiel. We're going to correct some stuff, some things, outdated information that I had, and just make sure we're on point. But I just want to say, somebody asked me, they said, you know, man, how are you doing this? What's going on? Why aren't you exercising your faith? Don't let anybody talk you into going away from what's smart. And the last thing I'll say is that COVID-19 is not listening to the governors and the presidents and the mayors. It's not stopping because they said it's safe to open the city. It's still there, and a lot of stuff we don't know about it. But hey, I'm going to leave that alone. Just be safe. Be smart. Bible says use wisdom. Use wisdom. We have a guest that we haven't had on the show in a long time. I'm going to say this. Don't get confused. You know, put your religion aside for a second. This used to be my work wife when we worked for That's what we called each other, work wife and work husband, when we worked for Enroll America. And if you remember Enroll America, we did the outreach and education around the Affordable Care Act. Right at 13 when everything started happening and dealing with expanded Medicaid and all those different things. So we have Marjorie Moseley, who is going to talk to us. She's working with Resolute, which is a certified navigator company, organization. In other words, they help you get enrolled in health care so that your hospital bills don't cause you to go into bankruptcy. That's not the only reason, but that's one good reason. Marjorie, thank you for being here.
Thank you for inviting me, and thank you for allowing me to talk about the Affordable Care Act and the things that are still in place for people and helping them to get back on track.
And so Resolute, well, you know, before we go into Resolute, I know that when we were in Enroll, and I think we both left in April
It was like 2016, something like that.
2016.
Yeah.
So had you still been involved in helping people get enrolled in healthcare and in Medicaid?
Yes, when I left in Enroll, I did go to work for HRS Resolute, and I was involved in enrolling people in Medicaid, the marketplace, still doing education and outreach and events to keep the community collectively informed about the options that are available to them.
Okay, and so now you're back with Resolute.
I got re-recruited.
You're a re-recruit.
Yeah, I was a new old recruit. Got a phone call and they were like, Marjorie, what are you doing? We'd like to have you back. And I accepted the offer.
Okay, and so you kind of explained, but a little bit more in depth, what is Resolute certified navigators. And for people who don't know what navigators, I mean, do you like show planes how to do their run or what?
So we navigate the healthcare system. So we navigate through the process of the marketplace, which is a paid option for healthcare, or we navigate through the Medicaid application process, which is a free process to people that meet the income guideline. And it's real important that people understand in Ohio, we do have expanded Medicaid, which allows all citizens to be able to get health insurance.
Which isn't offered in every state.
That is very correct.
Right? There are some states that did not expand Medicaid, which let a lot more people fall
And they still
through
have
the
it
gap.
to
And they
this day.
still have it.
Right.
So on the Medicaid, let's talk about Medicaid first
Yes.
before we jump into the marketplace. And especially because I think more and more people now are probably going to be headed toward Medicaid with a lot of the layoffs. And I noticed that there was a report last week where it said a lot of the temporary layoffs are now becoming permanent layoffs. And there were so many people who had their health insurance attached to their job. And with the job gone, the health insurance gone, unless you can afford COBRA. So other than that, then they're going to be moving to the marketplace. So just on, you mentioned the financial guideline. And so I know the family of one, if you're one, a single individual, and you're making $17,609 or less,
Yes,
you can go apply for Medicaid.
that is correct.
So just so that people understand, what all does I apply for Medicaid, I get approved. What is it covering for me?
So it's covering your doctor's visits, it's covering your pre-existing conditions, it is covering the fact that you can get the preventive. So the same things that your pay insurance provided at your place of work is the same type of insurance. And we won't talk about the providers because I'm not here to promote the providers of the different brands that are out there. I'm just promoting the fact that you can get enrolled and we can take the necessary steps to help you.
So not dealing with the providers, but the things that are available. Does all Medicaid come with vision and dental?
Yes, it does.
So there's not a situation like I know in Marketplace
You have to request it,
but
but
Medicaid
in the Medicaid, it does have it.
So automatically, is there a what is it a pay cap on your treatment?
No. You can utilize this just like any other type of insurance. However, you've got to make sure your doctors are taking this, and if you previously had it with your doctor, you just need to make that phone call and say, I'm back on Medicaid, I really need to make an appointment. I haven't had a physical. We need to make sure people are using the insurance, getting their physicals, and doing preventive care, because that is what turns the whole mechanism of healthcare around.
What is preventive care?
Preventive care is those things that you do yearly. You know, for females, it's getting their mammogram and their pap smear and getting a complete physical, and the doctor looks at your charts and sees if you need some blood work and your diabetes test, and those types of things are preventive.
Okay, so it's going to cover my dental, it's going to cover my vision, it's going to cover pre-existing. So me as a heart patient, if I end up on Medicaid, I can be assured that I'm going to be covered with that and whatever treatment is needed. Now, I know there are certain doctors or caregivers that you've got to be sure that they accept Medicaid.
That's correct.
What about hospitals, though?
Now, I don't know all of the hospitals. I know University does, and Children's accepts Medicaid, but I can't speak to all, because, you know, you got private
But there are some that
public
don't accept
and
Medicaid.
nonprofit hospitals.
Okay. So the 17,609 is the limit that a single individual
That's the
could make
economic limit. That is what you can make a year.
a year.
And if they see that you go over, it's monitored. They will let you know, like your Medicaid is going to be canceled. You may need to look into the marketplace. So, say that you do go over $1 or 50 cents or a penny. There are great opportunities economically that can help you with your insurance. You just have to go in and apply. We like to be there to assist you so that we can talk about everything that you need, so that you get what you need. You just don't want to take anything and be like, I thought I had this. No, you talk to somebody so you can get what you need, so you have what is necessary for you.
So I want to ask an idea and we're probably going to bounce back and forth between Medicaid and the marketplace,
yeah.
right? Mm-hmm. But before I ask you about what type of things someone needs to look for,
Mm-hmm.
or what type of things you're going to be able to help make sure that they're looking at in making this decision. 1 penny over the $17,609,
Mm-hmm.
excuse me, can put me
Moves you right into the marketplace.
to marketplace. 1
Correct.
cent.
1 cent. Because you're over the guideline.
It's over the guideline. What is that monthly? Do you have the monthly breakdown on
I
here?
do not have the monthly breakdown on here. I just have the income guidelines. It is $1,467.
So if you're making
That's monthly.
$1,467.
Yeah.
Because sometimes we don't know our annual
Right.
income. Sometimes we don't know our monthly income, right? But if you add up what you're averaging,
Mm-hmm.
you want to make sure that you know. So that way, especially if you need health care, you need to get into a doctor, and that way you're not spending, what is it, 35? How long is it a wait to find out about Medicaid?
We can get a notification from the Department of the Welfare Department. They're the ones that approve it. So I believe now it's anywhere between 30 to 90 days, but it could be less. But due to the current situation we're in medically now, it might could take longer. But as long as you have completed the application, you do have that information that you can provide if you go into the doctor to see somebody.
Oh, okay.
I've applied for it. I just haven't gotten my
And they'll still see
information.
you with
they
that?
should still see you.
Okay. All right. Well, that answered my question then. On the marketplace, what are things that, as a navigator, certified navigator, are you able to help people as they navigate through marketplace? Because I know the marketplace can be interesting.
Yes.
I remember
it can
that
be
much.
challenging.
Yes.
And but what we look at is the different plans that are there. So they're from basic to premium, based upon your healthcare needs. So, for example, I did have the marketplace for a minute. So I went all the way to the high end of it because, one, I wanted to minimize my out-of-pocket costs, and the fact that, yeah, I'm going to have to pay a copay when I go into the doctor. And at that time, I probably was going a little bit more frequently. But it depends on what you have to do. If you got to see specialists, all of those things you take into consideration. We look to see if your doctor's in that plan that you're looking at, and if you have a subsidy. And the subsidies still do exist.
So they are still there.
Mm-hmm.
But the mandate, right? So
the mandate is not there.
Okay.
But I don't want to get into if you don't have health insurance, then I just want to say it's better to have than not to have, because sometimes not having can be very stressful. If something happens, you know, you break a leg, the kids break a leg, whatever, and it's like, oh my God, look at this bill. But there are services in place at many of the hospitals, but they also will sign you up for Medicaid in the hospital if you meet the
Right.
income guideline.
So also, there or does this still apply in the marketplace? I know when we were doing this together, that you also needed to know your medications.
Yes.
To be sure that the plan you're picking
Covers your meds.
because every plan doesn't cover everything.
Right.
And so that's real important. So that's
That's
another
real
thing.
important that when people decide that they are going to apply, make sure you have everything. Your doctors, your specialists, even your dentists.
The hospital.
Hospitals that you utilize, and see, do they partner? And then once you have all of that information, then we can look for a plan that meets your needs. We don't push you in anything. We help guide you and assist you.
Okay. So you're going to help look at plans. You're going to help look at subsidies, which is real important when you're picking a plan, because you look at the plan and it says $400 a month, and if you don't know that there is some help with that, you see $400 a month, and you just go,
no,
I can't do it,
I can't
and then you
afford
back
that.
away
Right.
without having
Taking it a
someone to
little
do
step
it.
further.
Right.
Yes.
And so what is that so what are the subsidies? Let's talk about that for a minute.
The
What does that mean?
subsidies are based upon the income and the plan you take. So I can't speak to any exact, but I can give you a possible example.
Not so much
If
in
that'll
terms
be
of what they are, but what does having a subsidy mean?
It means it cuts your costs. It cuts your out-of-pocket costs for your premium, your monthly premium. So this has happened. Doesn't mean it's going to happen in every situation. But there were some people that had paid less than $20 a month out of pocket for their premium because of their subsidy in their situation. So every situation is different. That's why it's very important to sit with somebody that's familiar with enrollment so that you don't become frustrated and discouraged and give up.
And that's where
I come in.
Marjorie comes in to guide. And I remember watching you when we worked together, and you and people like Ariel and Brenda and all these folks who really helped people get the best. It's like it's all there, right? But it's like it's a pot of soup. And if you just dip in, you might just end up with a bowl of broth without dipping down further.
And getting all those vegetables.
Where the vegetables have
Right.
settled. And so I know that's kind of maybe a crazy analogy, but in a sense,
really makes sense.
that is what you're doing in terms of helping people get the coverage they need. So can you walk us through what a typical but
they
meeting with you
vary.
would be?
So and now we're doing them over the phone.
It's over the phone,
So
right.
it's really different. So we're going to talk to them. We're going to get their information and verify it. We're going to put that in. The marketplace is going to ask them some security questions about their address, possibly their phone number, maybe the high school, maybe the first car they purchased or what color their car is, those types of things, because that can validate you. And then we will proceed on to asking some questions about them, maybe their age, so forth and so on. And then we get down to the nuts and bolts. We're going to go into the plans. We're going to talk about the plans, what type of plan you need or your family, and we're going to look at them. And I'm on the phone, so I'm going to talk to you about them. So this is what's available. How does this sound? What do you need? Let me see if your doctors are in that plan. If we run into some dilemmas, we'll call the marketplace, because that's what they're there for, to assist as well.
And you can still reach them even
Yes, the
during the
marketplace
time of
is still
COVID.
up and running, and they are available.
So I remember this from back then. If you pick a plan, you go through it, you pick a plan, you're happy with it, you love it, you're ready to marry it, and it doesn't start until they actually receive your payment.
It doesn't start. They will send you the paperwork, and they'll tell you when your first payment is due.
So you can't pay it. So I picked the plan. I'm sitting with you today. I picked the plan.
Right.
I can't pay for the plan
The
today.
provider has to send you that information, just like with your own insurance at your place of employment. I have insurance, but I can't use it because I haven't gotten my plan with my cards and so forth and so on. It is still a process.
Okay. Because I think some people were under the impression that if I go online, I can pick my plan, have my credit card ready, not swipe it, but enter in the information, all is good, I'm ready to go, and now I can go and get the...
So everything goes back to the brand or the provider. So whoever you select, I'm not calling out names because I don't want to get in trouble, whoever you, the consumer, selects, then all of that information is sent to them, to their enrollment side, and they send you out a packet with your cards and all of the data that you need to utilize your health insurance. But if you have an emergency, you do need to go to the emergency room.
Oh, well, I'm glad you said that.
If you have an emergency, you need to go. And if you live in the city of Cincinnati, we have health clinics, and they are the model for the nation. We were the first city in the country to have health clinics, and we have been the model for the nation, and they are good. They're excellent. And now that, things are being streamlined and services are improving, they give you an appointment, you get there on time, you're moving through very quickly. It's not like...
If you get there on time, I like that part. No, seriously, you get there on time,
You
right?
got to be on time, It's just like with anything else. They make an appointment for a reason. And it moves very swiftly. It's not like you're there all day and, you're aggravated because you've been in the doctor's office all day. No, it very strategically moves very swiftly. You get in, you see the doctor, they do what they need to do. If you're getting a physical, they tell you what you need, so forth, so on, and boom, you're done.
Well, let me ask this. You mentioned with Medicaid, if I go through, I've got all the stuff done, everything I've enrolled, I get a number and blah, blah, blah. Not my benefits number, but the number or whatever it is that I do. And I need to go to the doctor. I could say, okay, this is what I have, I've applied.
Right.
Now, if I've gone to Marketplace and I've gone through everything, we've worked it out, we picked the plan, I've signed whatever it is I need to sign or e-sign or however it's done, and then I'm waiting to get the information from the provider, but all of a sudden 2 days after I finish enrolling, I have to go to the hospital. Will that be retroactively covered by the plan that I chose?
What'll happen when you're brought into the emergency room, they're probably going to ask you, do you have health insurance? You're probably going to say yes, but I'm still waiting on my plan. I applied through the Marketplace, and they are sending me A, B, and Z, and this is what I have right now. You should have a number at the end of the conversation or the end of the enrollment in case you have any questions with regards to the provider that you selected.
Okay, so somewhat like Medicaid, and then maybe by the time...
Just like any other insurance. Like I have insurance. It's Blue Cross Blue Shield. I just don't have a number. If I get sick, I got insurance. I just don't have the information at hand right now.
So then a hospital or a provider can do like they do when you've already gotten your packet and everything. They can go into the system and look and see
They can see what's going on.
Okay, so then that part is good. They're covered. Medicaid does the same. Marketplace does the same. So I sit with Marjorie and you help me through and we do all the bells and whistles that day. 90 days pass. Still, from the Medicaid side, still know nothing.
We can call the welfare department, Jobs and Family Services, and they have a Medicaid section in every county. And for Hamilton County, we would call the office that's down on Central Parkway and speak with them and see where it's at. Because that application goes directly to them, into their online universe to be processed.